Welcome to the second part of this lecture, which is on the organisation and structure of Ministry of Health Malaysia. This chart shows the general organisation structure of the Ministry of Health at the federal level or the headquarters. We will focus on the technical component of this organisation structure, which is headed by the Director General of Health, who is a medical doctor. Basically, he has several deputies to assist him, namely Deputy Director General of Health Medical, Deputy Director General of Health Public Health, Deputy Director General of Health for Research and Technical Support, and 13 State Health Directors. The vision for health states that Malaysia is to be a nation of healthy individuals, families and communities through a health system that is equitable, affordable, efficient, technologically appropriate, environmentally adaptable and consumer-friendly, with emphasis on quality, innovation, health promotion and respect of human dignity, and which promotes individual responsibility and community participation towards an enhanced quality of life. The mission of the Ministry of Health is to build partnership for health to facilitate and support the people to attain fully their potential in health, motivate them to appreciate health as valuable asset, take positive action to improve further and sustain their health status to enjoy a better quality of life. At the state level, generally, each State Health Director has 3 deputies taking care of medical, health and management. Public health services is under the purview of the Deputy Director for Health. His main objectives are ensure that the preventive activities are carried out effectively and efficiently, to coordinate the activities with the various departments in the state, prepares the budget and ensures that the money is spent accordingly based on allocation, acts on behalf of director when necessary. Here is the organisation chart of the state level, headed by the State Health Director and assisted by several Deputy Directors. For medical services, it is led by Deputy Director for Medical. For health services, there are 2 deputies, one for health and another one take charge of dental services. For management, there is a Deputy Director for Management, and for technical support, there are Deputy Directors for Pharmacy as well as Engineering. The officers responsible to the Deputy Directors are, just to name a few, Health Officers for Family Health, Epidemiology, Occupational Health, Vector and Elderly, Health Education Officer and Nursing Sister. This slide shows the health staff in their different colour uniform. For the nurses, who are in white uniform, their rank differs based on the different colour of the band on their cap. Nurse in blue uniform is the sister. Doctors wear the white coat. Here, we also see a community nurse monitoring patients at home, doing their home visits, usually for antenatal and postnatal care. I will now take you through the important duties of some of the health officer. Some of the duties of the health officer taking care of the family health program are overseeing the maternal and child health services, supervision of the family health program, conducts training of family health staff, and organizes budget for the family health program. The health officer for epidemiology, he monitors all the communicable diseases, responsible for the outbreak of cholera and other communicable diseases, informs the medical officer of health of all problems relating to communicable and non-communicable diseases. He also supervises and conducts epidemiology courses for the doctors and health inspectors. He also conducts surveys and research. Here are some of the duties of the health officer for occupational health. He identifies the occupational and environmental problems. He conducts surveys and research in occupational health. He implements the Factories and Machineries Act. He conducts training for health inspectors and examines factories for violations. The health officer for Vector is responsible for the outbreak of malaria and dengue in the state. They do surveillance of the two diseases. They take corrective action to prevent further outbreaks. Active case detection and passive case detection is also done. Bed nets and other preventive measures like larval and adult mosquito control will be done as well. The health education officer plans for health education in health centers and hospitals. They distribute health education material to the districts. They coordinate healthy lifestyle campaign. They plan and produce health education materials for the state. The nursing sister is responsible for all the public health nurses in the state. They plan for the training and ensures that there are enough nurses in the state. A senior health inspector plans for all the health inspectors in the state. Health inspectors are involved in all the preventive activities. They are involved in food quality, vector, environment, housing plans, and also food outlets, closure of food outlets, and also involved in anti-smoking campaigns. This is the organization chart at the District Health Office. It is headed by the District Health Officer. There are basically two major components, namely the administration and services. The administration component covers the human resource management, financial management, resource and supplies, health information system, quality assurance and control, whereas the services component covers the family health services, the diseases control, food quality control and nutrition, workers and environmental health, health promotion and education, environmental sanitation, and water quality control. Our primary care service runs as a two-tier system, where one main health center is in charge of 4 smaller community health clinics. The main health center covers approximately 15 to 20,000 population, and each community clinics covers approximately 2 to 4,000 population. Here are 2 photographs of community clinics. Klinik Desa Bunga Raya in Keningau, Sabah, and Klinik Desa Gesing in Raub, Pahang. Klinik Desa or KD Bunga Raya is the old structure, an extension of the previously called Midwife Clinic Cum Quarters or MCQ, where the midwives, now community nurses, stays in the quarters adjacent to the clinic. KD Gesing is the new design, double-story building where the ground floor is the clinic and the community nurses stays on the first floor. Usually, there are 2 community nurses posted in each KD. Here are the older photographs of the rubber estate clinic and hospital, which is manned by medical assistants. Here are some photographs of the district health centers, Klinik Kesihatan Kuala Kerai in Kelantan and Klinik Kesihatan Serendah in Selangor are the newly built and newly designed health centers. Here, we see the older structure of the health centers and maternal and child health clinics, or previously it was called the Klinik Kesihatan Ibu dan Anak, or KKIA. This is the hospital building. The smaller low-rise buildings are the district hospitals and the high-rise building is the general or state hospital. Currently, most government district hospitals have specialists and are able to provide better services. The newer government hospitals such as Putrajaya and Ampang are now paperless or IT-based, and appear as good as the private hospitals. This concludes the second part of this lecture, which is on the organization and structure of Ministry of Health Malaysia.